Now, what we need to talk about here is blood typing. So some of you may know your blood type. What we're going to do is talk about how blood typing occurs, and then in the prac this week you'll also have an opportunity to prick your finger and work out what blood group you are. Don't then go home and say, I know what blood group I am, because it needs to be done, of course, in a far more clinical test with some venous blood being drawn from a vein, where it is gone off and tested for by full biochemistry tests. But this will give you a bit of an idea. So blood typing is dependent upon the surface antigens. When I say surface antigens, I mean the antigens that are stuck to the surface of the red blood cell. So they're on the surface of the red blood cells, and they're proteins that are identified to cells in the immune system. Normal cells ignore the surface antigens, but foreign cells get attacked. So if I'm blood type A, then the surface antigens I carry are not attacked by my normal blood. So blood types are genetically determined, which is why if a child, if we don't know who the parents are, or there is a custody dispute over whose child it is by the fathers, then blood samples are taken. So we're looking at for the presence or the absence of red blood cell antigens A, B, and H, RH, or D. So there are 4 basic blood types: AB, AB, and O. And we're talking about the surface antigens. So the type of blood tells you what type of antigen that is on the surface. So type A, that means the surface antigen on the person's red blood cells is A. B means that on the red blood cells of that person is the B antigen. Some people have both A and B antigens on the surface of their red blood cells. So they're blood type AB, and the people who have neither antigen on their red blood cells are called O, or 0. O. Now, agglutinogens are also on the surface of red blood cells, and they're screened by the immune system. And these plasma antibodies attack and agglutinate foreign antigens. So they cause blood to clot. This is where you as a registered nurse play a really important task when you are checking blood groups for patients who are going to have blood transfusions. The Red Cross Blood Bank can tell you that the biggest error that will occur is human. They've got all the computers that will do all of the screening, the biochemistry and the matching and things like that, but it gets down to humans who physically take the blood pack and put it up, and they put up the wrong blood pack with devastating results. Right, so now we're looking at plasma antibodies. So a person with blood type A, which means they have A antigens on the surface, that means they have type B antibodies circulating in their plasma. A person with type B has B antigens on the surface of their red blood cells, but type A antibodies circulating in their blood plasma. Type O have neither A or B antigens on the surface of the red blood cells, but in the blood plasma they have both A and B antibodies. The person with type AB blood has the A and B antigens on the surface of the red blood cells, but in their plasma they have neither A or B antibodies. So you're going to have to sit down and get this clear in your mind. Here is the diagram. You can see it clearly in your book. So here we've got the person with the type A blood. You can see attached to the red blood cell is the surface antigen A. And then carrying around in the blood plasma is the B antibodies. If a person is type B, they have the surface antigen B on their red blood cell, and they have the A antibody circulating in the plasma. If we're looking at AB, On the surface of the red blood cell, they have both A and B antigens, but in their plasma, they have neither A or B antibodies. Type O, they're looking that this person has neither A or B antigens on the red blood cells, but in their blood plasma, they have both A and B antibodies. The Rh factor is also called the D antigen. This is particularly important for women when pregnant because their baby may be Rh negative or Rh positive, depending on what they are and depending on what the father is. So sometimes babies need a special injection to help them cope when they're just about to get born. Here is where you play a big role in cross reactions with transfusions. So it's called a transfusion reaction, and the plasma antibody meets a specific surface antigen because the wrong blood product has been put up, and the blood will agglutinate and hemolyze and clot in the patient's arm, and this will cause death. This will occur if the donor and the recipient blood types are not compatible. This is what a blood transfusion reaction will happen. So if this person has got surface antigens on the red blood cell and the opposing antibodies, and what will happen is that you have a reaction because the antibodies have been present in the blood, the surface antigens have been introduced to the blood, it reacts and it destroys the red blood cells. Testing for transfusion compatibility is performed on both the donor and the recipient for compatibility. So those of you who are blood donors, you know that when you go and have your blood tested, first off they prick your finger, they take your blood pressure, they prick your finger to see that you've got enough blood to spare and that your hemoglobin is within the acceptable range for a donation. And then you'll be asked to hop up on the bed, and then a needle will be put into your vein. You'll donate about 500 mils of whole blood, and then they will take samples and fill up about 3 test tubes, and all of this will go off to be tested and group and cross-matched with your particular blood sample. Then if a person needs that blood, they will have blood drawn from a vein, and that will be group and cross-matched as well, and then the computer will match up as closely as possible so that they will undergo what is called group and cross-matching to make sure that all of the blood is as closely matched as possible. If we're unable to do that and the person needs blood, then we can give them O negative, which is the universal donor. So this is the type of experiment that you'll be able to do in the labs this week. So here you can see if a person has blood type A. We're not doing the anti-D, so forget that bit. Forget the anti-D column. What we're just looking at is anti-A, anti-B with blood type A. So you can see that blood type A, a drop of blood, and then the tutor will drop some antigen on antibody onto it, and you can see that blood type A, if you follow across with anti-A, it will cause the blood to clot. If a person is B positive, we get that reaction. If they are AB positive, we get that reaction, and if they are O negative, we get that reaction.